Well, hey there, everyone. Dr. Lisa Faast here, and it is Tuesday, the day after Monday. And the Monday I'm talking about is the Monday that Trump signed his executive order on prescription drug pricing. Now, there's been lots of chatter about this, lots of what ifs, still a lot of unanswered questions. I did email out to all of you that are on my email list. If you're not on my email list, you should get on my email list. And a kind of just like a summary of it, what was the executive order that was actually signed? Like what did that say? What are the next steps? What are like my impressions or thoughts or ideas like on how this is going to like change the world? And I do think it is going to change the world. Now, it is not going to happen overnight. I've explained it to people like I feel like we're at the top of the mountain, like the Himalayas, and there's like this little pebble that just got pushed off the edge and now it's rolling, and eventually it's going to collect a lot of mass and be very powerful. But it doesn't feel like maybe the start we thought of. I know many of you out there that watch these are like me and a pharmacy owner. And frankly, we want blood, right? Like we have been beaten to bloody pulps as pharmacy owners by the bad guys, which most cases it's the PBMs are the bad guys, but there's some other smaller players in there. And we want revenge. We want vengeance. We want the gladiator style battle, and we want to see them bloody and losing teeth and begging for mercy. And unfortunately, I just don't think that's going to happen. Not that it couldn't happen, Trump could have got in there and did something different, but instead, what I think a lot of pharmacy owners don't realize, because frankly, we're a little blinded by our emotions, is that Trump essentially took away all the power of the PBMs. The reason that the PBMs are trillion-dollar companies and can beat us to a bloody pulp with nobody calling the police to stop them is because of our current pricing model in the United States. Now, on a whole almost kind of separate soapbox, I have actually talked about for more than 15 years, since I started my first transparent PBM, like complaining why the US has to burden the costs of the world's R&D for drugs. Like, why are we the only country that pays for that? So certainly there's a fairness factor in there that is a part of this, but I want to talk to you about the PBMs because I know a lot of you are just not happy without the blood in the water with the PBMs. But I want to kind of help explain it to you that this very much is a killing blow to the PBMs. Now, it's going to be a long, slow death. They're not going to go down easy. As Trump even mentioned in the live press conference, they have the largest lobby out there. They like to say, or the fact they like to put is there's one lobbyist for every elected official, as Trump says, and I think we all know it's more like 3-to-1 ratio. They really are the most powerful lobby that exists in our world, and that's because there's so much money at stake. And the reason that they can have so much money is because of the smoke and mirrors with pricing. The fake AWPs, the fake wax, the fake pricing, the fake rebates, the fake pay to play, all of those kinds of things that the PBMs control behind closed doors. It certainly does not operate out in the open. Otherwise, we'd all throw our hands up and they'd be done long ago. And so what implementing the most favored nation pricing does is it starves the PBMs. All right. Like there's lots of way to kill a beast. I think many of us would like it to be torn to shreds, but starving it works as well too. It just takes a lot longer. It's a lot more painful, and allows for things to happen, somebody to slip in some food and prolong it a little longer. But this is starving the PBMs at the core. With most favored nation pricing, where everybody knows the price of a drug, they know exactly what the price is, where everybody knows what the cost is. The PBMs can't do their money moving, their secret money moving, calling certain monies, rebates into buckets or not rebates and fees and, all these kinds of things. They can't lie to their customers, which their customers are, the payers, the people who pay them to manage their benefits. They can't lie to pharmacies saying, oh, that's not the actual price of the drug. You're just paying too much. You can actually get it, $200 somewhere else, but oh my gosh, we can't tell you where. These these fake numbers. And yes, I understand the relationship between AWP and WAC. I do consulting with some smaller pharma companies, but AWP is a completely made up price. It has nothing to do with the cost of the medication. AWPs are made up to work in this crazy ass world of pharmacy pricing that we're in. And so it's the most favored nation pricing really does hit a killing blow to the PBMs. When you have full transparency in what things are cost, what the manufacturer's charging, it takes away all the negotiation power. We all know the fake line that the PBMs put out that say, hey, we help save pricing, we negotiate drug prices, look at all these rebates we earned for you, which is basically a pay-to-pay formulary, transaction fees, bribes, if you will, that they disguise as rebates. All of that goes away. You can't do that with most favored nation pricing. And so in that same breath that I'm trying to explain to you that this really is a killing blow, the fact that it's a killing blow means that they're going to fight hard to protect it. They're trying to protect their trillions of dollars of money. No longer will, the CEO PBMs be able to make tens of millions of dollars a year if they're just processors, which is what they're supposed to be. I am okay with PBMs existing as a transaction processor. Like, not a problem there. Kind of like the credit card companies. I don't really like them. I don't like paying my percentages to them, but it's kind of like one of those necessary evils, because we do like the convenience of immediate transaction processing. So, but we've got to take away the other 99% that the PBMs do currently nowadays, where they do make their billions and trillions of dollars, what causes us as consumers, so not just pharmacy owners, but yes, we're pharmacy owners, but we're also citizens of this country. And it's not fair. It's not fair that we as citizens of this country pay far higher prices for prescription than any other country in the world. And just like Trump, I am okay with subsidizing, third world countries. I'm okay if we don't force third world countries to, play in this game. But other industrial nations, absolutely. He talked a lot about the EU. I think he mentioned Australia in the press conference as well. There are a lot of other industrial nations that we truly are subsidizing their prescription part of their economy, if you will. Now, I'm sure it probably happens in other areas, but I'm not familiar with those other areas, but I'm very familiar with the prescription area. I do travel a lot internationally, thankfully, and you see this, I go to Mexico to buy drugs. I've talked about that. Everywhere I travel, obviously, I always visit pharmacies because, one, it's fun, but two, I like asking questions and I like figuring out what it's like in their country. And everywhere we go, drugs are a tenth of the price. And not, and I really truly mean a tenth, not like a little bit cheaper, like majority 80-90% cheaper. And it is just not fair. Like, it's kind of like that fairness clause. And I know the world isn't fair, Lord do I. But we've got to fix that. And I think what Trump did fundamentally starts to fix this crazy world that we're in, by forcing other countries to raise what they're going to pay for these drugs. We can lower what we pay, and it creates transparency right from the get-go before it even hits the PBM. A lot of us had asked for transparency in PBMs. I don't want transparency with PBMs. I want transparency before it even hits the PBM. So if it's public knowledge, for example, what Lilly sells their drugs for, then the PBM can't make up some story of inflating the price by 200 to give a kickback to be on formulary, to, move it to this bucket of money over here. Like, they just can't be done. So by enforcing transparency before things even get to PBMs, it really does cut off the legs of the PBMs. So here's my little supplemental video for the information that I put out yesterday. Kind of what are the next steps. In Trump's executive order, he gave the secretaries 30 days to kind of like start to figure this out. I think the exact how is completely all left up in the air. I think it could go terribly wrong if it's implemented incorrectly. I think it can go awesomely right if it is implemented correctly. I know I'm leaning into my circle of friends and influence to try to reach the right people that, are going to be the actual movers and shakers behind the scenes with this. Not just to give opinion. I actually want to hear what their plans are. So I'm trying to get them to kind of talk and share what the plans are with us as we can, whether it's on or off the record, just to try to answer you guys' questions. Like you have questions, I probably a lot of the same questions that I have in terms of like, how does this all work? What do I think you should do right now? So if you're a pharmacy owner, and you're a typical pharmacy, meaning regular retail, you have brands, you have generics, you got all those things. I think you buy down your brands as much as possible. I think at this point many independent pharmacies are already at that point, but some of you probably could go down even further. And what do I mean by that? Like literally don't have brands sitting on your shelf. At least not that you aren't going to use in the next 1 or 2 days. I know many pharmacies that got stuck on their heels and lost a lot of money with the insulin price changes that happened last year. And so if this does happen in a way that it kind of looks like it's going to happen, that means brand drugs are going to take a plummet in price. And you don't want a bottle sitting on your shelf that you paid $800 for, and now all of a sudden it's only worth $200, right? Like that's not good business. So get your brand inventory down to next to nothing. If you have brands that you can't dispense or you don't have prescriptions for, you can't return it. Look into selling it to other pharmacies. There's some great services out there. PBMs Marketplace has a pharmacy selling platform. There's several of them out there. Call up your local pharmacy, other pharmacy owners, see if they can use that inventory. Do what you can to get rid of that inventory before it becomes locked in, because there was a point with the insulins when there was a lot of chatter about the insulins where you could still return it to your wholesaler as long as it met their return policies. And then once it was solidified, those wholesalers stopped accepting the returns of the insulin. So I think we're still in that point a little bit where, you might be able to return some brands if it's in the return policies. But it's time to buy down your brands or sell through your brands, I guess is the better word, and have as little as stock on hand and start communicating your patients. Like, hey, if you're on a brand medication, we'll order it the next day for you. Like, we're keeping brands low in stock because of the changes in the drug pricing. And, once drug prices drop, last thing you want is, 10 bottles of a brand that, are 10 times the price. And, obviously you can't sell them. So I think it's important to be communicating with your patients and letting them know. That way they can, call in the refills appropriately, get those patients on synchronization, get those patients on a autofill program. And I don't mean just a blind autofill program, but a program that says, hey, you got your prescription 27 days ago. You call them up and say, are you ready for it? So it doesn't necessarily have to be a synchronization that they all get their medications at the same time, but kind of like a call ahead, auto check-in with the patient and see if they need it. That way you're ordering appropriately, you're ordering the minimum amounts. And stay tuned, stay informed. This is big momentum, all right? Even if you hate Trump and you don't get this whole most favored nation pricing, the pebble's going down the hill, right? Like momentum is happening. So go do what you think is best. Start talking to your state legislatures, start talking to your Senate, your congressmen, start talking to everybody, because I think this is the momentum. Like this is the major spark. We've started to have little wins. Absolutely. I don't want to diminish the little wins that have happened, at a state level. Some of them have been very big wins. But at a federal level, like this is one of the largest movements in our favor in any way, shape or form or size at a federal level. And so I really think now's the time to push hard, both at the state level and at the federal level, to fully get everything that we're fighting for, right? One of the reasons we're in this situation is, the pharmacy body as a whole over the last many decades has done a really crappy job of fighting for what we want and what we want to protect, while others like doctors and whatnot have done very well. So anyways, that is it. If you have questions, if you have thoughts, if you have connections, I am happy to help in any way, shape, or form that I can. I certainly don't have all the answers on this, but I'm trying to absorb as much information as I can. So never hesitate to reach out. And if you want an awesome pharmacy, I highly recommend you check into Pharmacy Badass University. That's my membership. That's what we do every day is we create awesome, profitable pharmacies that you will love owning regardless of what's happening in the world, which there never seems to be a dull day in pharmacy. So that's it, guys. I will talk to you guys later, and feel free to comment and I will answer. I do read them all. So adios until next time, guys. Bye-bye.